What? Hi guys, I'm Ash, this is Laurie, Ash and Laurie, and welcome to our channel where we share what we learn working our daily jobs as doctors so that you hopefully can learn something too. So that's the plan anyways. It's early days. We'll probably do we'll end up doing some mukbangs or something.
Mukbang? What is mukbang?
So you're Korean and don't know what a mukbang is?
No.
Oh jeez. Anyway, I'm a GP. Laurie here is a radiation oncologist. And some people might not know what a radiation oncologist is, which is partly the reason for this video. So, yeah, we can go straight into it. Yeah, what's a radiation oncologist, Laurie?
Ashley, well, I'm glad you asked. A radiation oncologist is a specialist physician who uses ionizing radiation to fight cancer. Radiation oncology is one of 3 primary specialists in treating cancer, the other ones being surgeons and medical oncologists.
Cool. So you're pretty much a cancer doctor then?
Pretty much. 99% of the time.
So what's the other 1%?
You'll soon find out.
So yeah, I've known Laurie for 14 years now. That was on the first day of medical school.
Cool.
So it's only now that you've become a fully fledged radiation oncologist. So that's a pretty long time, hey?
It sure is. It's been a long, long road, but we're finally here. It makes me feel very old. Too old for YouTube, maybe.
Yeah, maybe. But we got to connect with the youth today somehow, right? All right. So, tell us what is radiotherapy then?
Okay. So, like I said, radiotherapy, we use radiation to kill cancer cells. But to go back a little bit, so cancer cells, what are they? They're basically cells that are in your body that have changed and mutated, and they are growing and growing, regardless of your body's usual signals. They continue to grow out of control and take up all of the space in your normal healthy body.
Yeah, cool. So the way I explain it to my patients is that it's like in the Matrix movies 2 and 3, where Agent Smith doesn't follow the rules of the Matrix anymore, and he just keeps replicating until he takes over the whole Matrix. Which is ironic because in the first movie he says something like, humans
are a disease, a cancer of this planet.
In actual fact, he is the one whose attributes are more cancer-like.
Yeah, sure.
Yeah, so in the first Matrix, he starts out as the protector for the Matrix. So what cancer would he be then? A leukemia.
Oh, leukemia. Yeah. All right, good movie. Check it out, guys.
We'll cut that part out. All right, carry on.
All right, so radiation, there are different ways of delivering radiotherapy, but they all utilize something called ionizing radiation.
Yeah, so lots of things give off radiation, right? So someone told me if you eat enough bananas, you can become radioactive.
Yeah, not quite. So people don't actually become radioactive where they glow in the dark or go green or become the Hulk.
Good to know.
But in saying that, you're right. Everything in the world around us, like eating bananas or flying over to go somewhere else in the world, we do get a little bit of exposure from radiation. But all of these radiation are tiny, insignificant amount that don't really harm us. But in high doses, it can actually damage DNA of cells. And what we do is we utilize that to try and fight cancer cells.
Cool. Yeah, so radiotherapy is used to treat pretty much all types of cancer, yeah?
That's correct. There's a role of radiation in many, many different types of cancers. In my practice, I commonly see patients with breast cancer, prostate, brain cancers, lung, and also skin cancers as well.
Yeah. And radiotherapy is just more than shooting X-rays at people with machines. It can also be delivered from inside the body through implants or ingesting it in the case of thyroid cancer. I suppose the common question is, how do you avoid damaging the normal cells surrounding the cancer? For example, with the prostate, it sits pretty closely to the bowel, the bladder, and the rectum. How do you avoid damaging those things?
Yeah, very good question, very important, and that's what we really focus on these days when we treat our patients. So I see this as having three different aspects of the treatment. One of them is accuracy. So for each patient that we see, we take a detailed images using CT scans, MRIs and PET scans, and we use all of those images and those information to really draw each personalized anatomy of the patient, where the tumor is and where all of the important structures are. For example, of the prostate, what we also do is we put little fiducial markers. So they're little gold seeds that we put inside the prostate cancer. And we use those as kind of like bullseye marks to aim where the radiation goes. The other aspect is that there's been a lot of advances in the physics and technology of radiotherapy. Back in the olden days, what we used to do for treating cancer, say in the prostate, is that we used to shoot one beam from the back and one beam from the front. What that does, where the beams intersect, you're going to get 100% of the dose, and we assume that the prostate is right in the middle. That was great in treating the cancer. However, 50% of the dose goes through the front of the prostate and also from the back as well, so you get a lot of toxicities. Nowadays, what we do is we have all of this radiation beam that fans around the whole body while the beam is on, and then the beam is all modified and the fields are all changing as the machine rotates around. And that divides all of the different fractions, divides all of the beams to all of the different structures, minimizing the toxicity, but getting a really good control of the cancer.
Yeah, so that's pretty cool. So how effective is it in treating cancers, or I guess prostate cancer, if that's an example we're sticking with?
So radiotherapy is actually a very effective treatment modality in treating prostate cancer. There's been a lot of studies out there that have shown equivalent outcomes compared to surgery. For advanced prostate cancer, radiotherapy is actually preferred over surgery. In saying that, there's so many different types of cancers that people can get, and depending on the cancer type, the outcome is very, very different. And also the treatment that the patient should get, or the sequences of the different treatment patients should get, are all dependent on the different types of tumours, how the patient is, their age and their comorbidities, and what stage that they're at. So it's important to go see all the necessary doctors and listen to all of their different advices.
Yeah. Okay, so I guess if people have more questions about radiotherapy, is there anywhere that they can go for more information?
Yep, so I would say for the patients or people that have been diagnosed with cancer, or they know any family members that are going through this and have more questions, first, great avenues to go see your local doctor, someone like Ashley here, who can provide some information about the type of cancer and the different treatment outcomes available, treatment options available. But also they can offer some support and counselling regarding dealing with cancer. They can direct you to different online resources as well. A couple of the good ones are Targeting Cancer and Cancer Council. We'll put the links down below, so check them out if you have any interest. And that's pretty much it from us today. Hit like and subscribe if you thought that this video was useful at all. There's going to be more to come, so stick around, and that's it.
Yeah. See ya.
See ya. Bye.